this afternoon, there's a big push for government to implement laws that require the state to fully pay for medical care of victims of domestic violence, even though there are laws that provide for free medical care for such victims. Many, if not all, health facilities in Ghana charge exorbitant fees before attending to victims of domestic violence, and in most instances before issuing a medical report to facilitate legal processes. That has been topical in the discussions here in Accra as Plan Ghana seeks the support of stakeholders to get government to implement those laws in a stringent manner. Shortly, we'll be hearing from the group. We'll be speaking to the country director for Plan Ghana. But first, my colleague Maxwell Kudeko sat through the engagement today, joins us via Zoom. Maxwell, first of all, let's understand why stakeholders are actually concerned about this situation.
Well, there has been a major challenge with respect to seeking justice for victims or survivors of domestic violence. One of the major challenges has to do with gathering of evidence for prosecution, especially when it comes to issues of rape. And you know, by law, you need to prove by evidence that indeed there has been a penal penetration. But coming forth on this particular evidence has become a problem for the justice delivery system. Now, the issue is that most of these health facilities, whose duty is it to produce this medical report and also to care for victims or survivors of domestic violence, are charging exorbitant fees. Meanwhile, there are provisions in Ghana that provide for free medical care for victims of domestic violence and, for that matter, rape. So if you look at Section 8.3 of the Domestic Violence Act 2007, Act 7.3, it says that victims of domestic violence who is being assisted by the police to obtain medical treatment under subsection 1C is entitled to free medical treatment. However, when you go to the hospitals, the norm is that medical officials has to charge money, even though you reported to the police station or the medical report, they still have to take money. And in most cases, especially in rural Ghana, some of these victims do not have money to afford for this kind of services. So in the end, they are denied healthcare, and then also justice is being denied. There are several other laws, including the Domestic Violence Regulation 2016, LI 2237. It's stated in Regulation 3. It also provides for free medical care. So this has been a challenge for people who are in the business of providing or protecting the interests of survivors of medical, or domestic violence. So Plan Ghana initiated this conversation with stakeholders, including the Ghana Medical Association, people from the Domestic Violence Victim Support Unit, members of Parliament, and then the Attorney General, and then also other legal practitioners, to fashioning out a way to ensure that these laws that provide for free medical care is being actually implemented in order to seek for the healthcare of victims or survivors of domestic violence. The argument has been that there has never been a day or an incident in the history of the medical or healthcare in Ghana where government has initiated move to provide for funding for some of these victims. The hospital need to find money to cater for all of this. So the conversation has been that, is it possible to...
Yeah, and I guess, Maxwell, it's a good time to also hear from the group itself, Plan Ghana, which is making such a huge statement, asking government to consider making that medical cost free. Is that feasible at a time when government says it has a tight fiscal space? Joining us now is Solomon Chesfa Mariam. Thank you for your time. He's actually the country director for Plan Ghana. Thank you so much for joining us. So first of all, where do we start from? You want an outright law stating that, or perhaps we start on a pilot basis, perhaps?
Yeah, thank you so much for inviting us for this engagement. And I truly appreciate the fact that Maxwell was with us this morning. I think he articulated well. I think maybe from my side, given the fact that Plan International as an organization, specifically in Ghana, we're all about justice for children and equality between girls and boys. But we also put a lot of focus in terms of making sure that girls have the same right. And in connection with our current strategy for Ghana, young people will have a big say. The foundation of our work is really sponsorship, where quite a number of people outside Ghana have been sponsoring children. Most of the children that we supported many years ago have become adults. And we've actually initiated an alumni group that will unite with our youth group to raise some of the pertinent issues that affect young people in general in Ghana.
Right, and I guess
within that broader sense, girls, boys, and women issue. So the issues that we actually engaged this morning was really critical because there is a strong belief, not only by our organization, by young people in Ghana, to actually eliminate all forms of payment when victims are actually approaching a medical facility to get medical treatment. The finding is, it was kind of surprising for most of us, but even for this wonderful medical doctor that was there, that the law has basically a provision, but it's basically the implementation which has been a challenge. So one strong recommendation that we came up today is how do we make sure that the law is fully implemented and the resources are also available to the medical facilities. And that is really one of the findings that we've had today. But it also means that we still have a lot more work that needs to be done to ensure that this is communicated across all health facilities in Ghana, but also to ensure that the funds are actually released in a very timely manner so that girls and women are well protected and are getting the necessary medical care, and that the perpetrators can actually come into accountability and into conviction.
And I guess that's why I'm very much interested in the approach and where to start from.
I think where we started is really a perfect place, but the second component, which is really critical, is for the Attorney General or for the Minister of Justice to communicate this clearly to all medical facilities. That is really a very critical component in this discussion.
Well, but given the situation in the country, what's your assessment of the issues of abuse and some of the reports that you're getting? What's your clear assessment of what's happening in the country?
Yeah, I think one of the things that we found out, reflecting just in the last 2 years, we were not only suffering as a result of a public health crisis with COVID-19, but definitely there were also quite a number of girls and women who were abused. And that is really the reality that we've seen. But I'm sure as a journalist, you must be able to see what's really happening. We see all forms of violence against girls and women in Ghana. And definitely there is far more that needs to be done by the critical elements of the Ghanaian institutions, the police force, parents, communities, traditional leaders, to actually prevent this kind of abuse and violence against girls and women. And that is really such a critical element in terms of addressing the root causes of this kind of violence against girls and women.
And how far would you say we're away from that target?
I think there is definitely a growing commitment. And the fact is that it was clear to us this morning that the government has actually a provision for it. But it doesn't help that we have the provision and the legal instruments. But the critical element is we also need to make a commitment to make it happen. That the resources are available, the resources are released, and that there is far more need for engagement to address this at rural as well as urban setup.
Anyway, we'll have to leave it here, but we're grateful that you've been able to share your concerns with us.